And it's a really exciting approach because you've already shown this works in Ebola. Tell us about the successes there.
Well, as you heard from Dr. Fauci, there's a lot of hope that antibodies that we can make outside of the body, we can make them recombinantly, it's called, in large bioreactors, can be given back to humans and essentially mimic the best of the type of immune response you could get from a vaccine without the requirement for a vaccine. So these treatments could be bridges or even alternatives to vaccines. As you said, we've done this before. We have a good track record for here, particularly for a disease that's much more universally lethal than COVID-19, which is Ebola, where we showed that an antibody cocktail that we had put together, that is, these antibodies that mimic what the body normally uses to fight a virus, that we could generate such a cocktail outside of the body, grow it up in bioreactors, purify it, give it back to human beings. And in these cases, for a disease like Ebola, which, as I said, is a much more horrific and universally fatal disease, we could say, for example, the people who were in early stages of the infection, more than 90% of them with our antibody cocktail. And so I think that that gives a lot of hope that a similar approach, which we're also trying for the coronavirus, will be at least as effective.
And we know that you are gearing up to start the first human clinical trials. Tell us about what the timelines look like to when this drug could potentially be available, maybe on an emergency use basis. None of the timelines we've been talking about during this pandemic for drug development are normal. So what do yours look like?
Yeah, we've done everything that we can to expedite and do everything at risk so that we could possibly bring these potentially life-saving medicines as soon as possible to address the pandemic. So we are initiating clinical trials hopefully this week with our cocktail of antibodies, and we're hoping that if all goes well, that we might start getting data in a few weeks, which means that perhaps by the summer, the end of the summer, that these antibody cocktail might be more broadly available to larger segments of the population.
And the fact that you have a cocktail approach that could potentially protect against the virus mutating, is that why you have that approach?
Right. So I'm sure everybody probably remembers or knows that for traditional viral drugs, antiviral drugs like were used for HIV or for hepatitis C, early studies involved single drugs, but very rapidly the viruses escaped by mutagenesis, and you lost the efficacy of these single drug treatments. So for traditional antiviral drugs, the fundamental realization was combinations or cocktails could not only perhaps provide more efficacy, better results, but would also protect against escape by the virus by mutagenesis. This was shown, as I said, first for HIV, but now is become the lesson. Well, for these new classes of drugs, these antibody approaches, that hasn't really been demonstrated, but a lot of us prospectively predicted it would be the case. We've recently shown that that is the case in preclinical studies, that treatments with single antibodies are prone to rapid viral escape. But when we put cocktails of antibodies together, which is what the body essentially normally does, those can be very resistant to this sort of escape. So that's why we prospectively designed a cocktail approach as opposed to just a single antibody approach, and are putting that forward. And that's the approach that for us will be in clinical trial. So others have focused on single antibody approaches. We were prospectively a little bit worried that they might lead to escape and subsequent problems more broadly. And so we endeavored to bring forward this cocktail approach.